Every Wednesday, we talk with Okoboji Wellness Clinic as part of Wellness Wednesdays. And now joining us, Dr. Bradley Meyer of the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Good morning, Nathan. Glad to be here with you and the crew that's the regular listeners or first-time listeners. Welcome aboard. We're gonna have some fun discussions as usual today. So.
All right, perfect. So I understand you were at the movies recently.
Oh, yes. We went to, my daughter's been wanting to see Wicked, and which is kind of a take on The Wizard of Oz. It's a prequel. And, the credits or the advertisements beforehand came up as per usual, and this one was on migraines. And it was a particular recommendation or option for folks for chronic migraine sufferers, and I believe it might have been an injectable, but it was a pharmaceutical, and it started to list off the long list of potential side effects afterwards, and I was thinking to myself, wow, I need to talk about migraines. We haven't talked about that for a while. And the fact that I think that there are a lot of folks out there that suffer with migraines unnecessarily and have been down the road where, again, there are a lot of different tools out there. Some folks choose the pharmaceutical road, and that works for them, and that's okay if that's the road they want to go. But sometimes when they go that route or they've tried a lot of things, they still are in this space of maybe I've got some improvement, but I still have them. Maybe they're not quite as intense, but they're still an issue. And what's happening, I found when I used to look at migraines, I used to look at it as blood flow and vasospasm, which is kind of a spasm of the blood vessels in the brain. I think there is definitely a neurologic component to it as well, which is the nervous system in the brain. And with regard to working through the avenue of, well, how do we actually get people where they want to go? Because they don't want to be in pain. They don't want to be fearful that, this migraine's going to come up and it's going to be at the most inopportune time. And that kind of uncertainty, and then I'm out the rest of the day because after I have a migraine, I'm really tired, and those are the things that are really impactful on people's lives when they have these migraines. And so when we start to look at it from the root cause approach, that's what we're doing here at the Okoboji Wellness Clinic. So again, we have folks come in and we look at all the systems. We don't just look at the nervous system. We look at the brain, but we look at the digestion. We look at the gut. Everything is connected, as we usually say, Nathan. And we look at what are you taking in? What are the toxins? What are the exposures to things that might be triggering these things? And then we develop loop patterns in the brain where if you get these long enough, it's almost like your brain gets hardwired into a pattern of reactivity. And so we have some work to do to kind of unpattern that a little bit. But it can be something as simple. This is a tip for folks to try, as simple as gluten or dairy. Dairy is a gluten mimic. And interestingly, there are little receptors in the brain that when the body is exposed, if somebody does have a gluten intolerance, and gluten it's kind of like a glue, and it's in a lot of our wheat products, bread, pasta, the crackers, those kinds of things, and it doesn't break down very well in our digestive tract, and so we can get what's called a leaky gut, and that gluten can get through, and our immune system starts to recognize it as the enemy, and it causes inflammation. Well, interestingly, there are receptors in the brain that every time that we start with an exposure of gluten, that can trigger for instance, a reaction in the brain, a migraine. And so a lot of tools, I've done hyperbarics has been an absolutely incredible tool in and of itself hyperbaric therapy, increasing oxygen and pressure, where our guests go into the hyperbaric chamber, looks like an ice shack, for 80 minutes. We do a series of those, and that is highly impactful on decreasing inflammation in the brain, but we're still always looking at what are the triggers. But I would say, with regard to migraine patients, headache patients now, I'm batting like 95%, maybe higher, with regard to getting results on almost, in some cases, completely getting rid of them. And so, but I brought Mychal Sheridan back on with me today again, and he is incredible. He does orthopedic massage. He really is a savant when it comes to the brain, and he does reflexive brain work, and he's a great part of the team here. He's been seeing some incredible results with the different approaches he takes, whether it's for insomnia or if it's for chronic pain. He works with folks that have Parkinson's. You pretty much name it. Every condition has a connection to the brain, obviously migraines as well. So I thought it'd be great to bring Mychal on to just give his perspective, his approach to how he's going to manage somebody that comes in with a headache or a migraine. And also the cool thing is, just like with me, I do discovery calls that are complimentary, 15 minutes, 712-339-6024. Give us a call if you want to start your journey, learn some more. He's going to do a same discovery call if you're interested in doing some sessions with him. I'm doing them now once a week, and we're making significant progress. I had a history of an Achilles tear years ago. And so he's unearthed some stuff in my brain, in my neurologic patterns that we're working through, and I'm already seeing some positive results just after 3 sessions. So without further ado, I got Mychal Sheridan here, and he's going to get some more information to you on headaches.
All right, Mychal, welcome back to the program.
Hey, how's it going?
Yeah, so talk about these different approaches, then, Mychal, that you have taken with people dealing with migraines.
Yeah, so when people come in and they've tried kind of the classic approaches, get enough sleep, look for food triggers, avoid dehydration, reduce your stress, and none of that seems to kind of break that loop cycle that they're in. They always kind of have headaches, migraines, no matter what they're doing, and it just they become fearful of doing certain activities because last time I got a migraine when I went driving and there was a bunch of snow on the ground. So when that happens, they've tried just the classical approach. There's a couple cranial nerves that I like to assess and see how they're functioning side to side. Cranial nerve 5, the trigeminal nerve, which is our motor control of the jaw muscles, and it also is sensory of the face. And if there's some sensory deficit side to side, just by finding that and applying vibration, light touch, maybe warm or cool, can break that loop cycle when it comes to vibration or when it comes to headaches and migraines. And then a couple other things that I like to do from the orthopedic massage standpoint is we are all very fascially connected, and we all carry a lot of stress either through the torso of the body or the arm and hands. So if I can release muscle tension down the chain, a lot of times it will release muscles up in the neck, and then we can, after we release those, we can retrain the upper cervical spine and retrain some maybe jaw motions to make the brain feel safe and not have that constant loop of migraines and headaches coming on.
Okay, perfect. It sounds like you have a lot of great approaches, and I know people that have dealt with migraines, and they feel like there's no end in sight. So knowing this, it's definitely an approach that they should definitely consider with you guys.
Yeah, and from a clinical aspect, I've had many sessions where I see a headache, migraine person, and it can be a one-and-done treatment where we just break that loop cycle, and that's good enough. Sometimes they need a little extra support, so we get them out of the cycle, and then we retrain some eye movements. So nowadays, everything's right in front of our face, so if our eyes don't converge well together, sometimes we need to retrain that a little bit.
And the cool thing is that you guys have already had plenty of success stories, and it's all about taking that first step into that wellness journey. So when it comes to, like Dr. Meyer said, discovery calls with you, Mychal, what's the best way to get something set up with you?
Yeah, if you just want to call the front office, and our receptionist would be happy to set up a call with you if you're curious for more information on my approach to the body and just the tools that I can use to help you get out of whatever pain cycle, whatever movement problems you have. My approach has been very successful to helping people feel better, move better, live better.
I was going to add this too then, Mychal. You mentioned you have plenty of successful stories with people who have dealt with migraines. Is there one success story that really sticks out to you, though, about, there was someone that had it really, really bad, and by working with you, they had that taken care of in a matter of a couple sessions?
Well, I had actually a very acute vertigo one come in yesterday. Not exactly migraines, but we got her nervous system to calm down, and usually this puts her out for 2 or 3 days. And then it wasn't yesterday, but I saw her Monday, and then she came back in Tuesday and said she felt night and day different from what usually happens when a vertigo comes on.
That is awesome. That's very cool. All right, Mychal, anything else we need to add?
Just be well and give us a call if you have any questions, and we can answer your questions.
All right.
Yeah, Nathan, I encourage everybody, just, again, we always talk about just the whole idea of a lot of times that self-talk that we can get into a pattern and say, hey, it's just aging and there's not much more I can do about it, and then just accepting it. So if you're not wanting to accept that, hey, maybe I don't feel good, I'm not living my day-to-day as optimally as I'd like to, from a brain fog perspective, to an energy level, to a pain perspective, to a digestion level, to a anxiety or mood level, because Mychal does a lot of work too with folks that really battle a lot with insomnia, anxiety, mood. We've got so many tools here. What a wonderful team. Molly Avery does such a fantastic job with folks on their digestion journeys and nutrition journeys, and learning about finding those toxins that we're exposed to, and how do we detox the body. It's a symphony and an orchestra that once we kind of get all these systems in tune together, and our team talking as we watch folks go through the process on this journey and in getting their system back into balance. And so again, if you're at that point, we have a Merry Christmas, everyone, and we come into the new year, a lot of times folks are talking about exactly that. All right, what are my next year's goals going to look like? And for most of us, we can say that we either want to prevent something, so we're not in a tough shape physically, in which case give us a call and we can go down that journey, or we already have something and it is something that is making us unwell, it's affecting us mentally or physically, and know that there are answers for you, and that's what we're here for, to walk with you, to be the guide, to be with you on that journey, give you some support, recommendations. The tool belt keeps expanding here at the Okoboji Wellness Clinic as we offer more and more offerings to help folks get back into balance and back living their best. So, yeah, give us a call, Nathan, at 712-339-6024. We're at just off of Highway 71 in Spirit Lake and 3305 Berquist Avenue. And I wish everybody a fantastic Wednesday.
You as well, Dr. Meyer and Mychal Sheridan. Thank you guys so much for coming on, talking about migraines. It's definitely one of those things that you could say a good amount of people deal with on a regular basis. So I appreciate all the information you guys have given us, and we wish you a great week and keep healing people.
All right. Sounds great. Thanks.
Thank you very much. That's Dr. Bradley Meyer and Mychal Sheridan with the Okoboji Wellness Clinic. Call them today to get started on your wellness journey. 712-339-6024.